My name is Stephen Brown. I'm Executive Director of the ACLU of Rhode Island. We are also here today to urge veto of the bill. We consider this legislation to be one of the most dangerous and intrusive invasions of privacy that we have seen in a long time passed by the General Assembly. It strikes at the heart of doctor-patient confidentiality and undermines the public's faith in our State Department of Health to be a protector of the deeply private information that is kept in its care. You've heard from the others about why this bill is completely unnecessary. You've heard that there already is a process in place through a judicial warrant to gain access to this information. And throughout the entire legislative process, I have still not heard one compelling rationale as to why that warrant process is a problem. None. It may be more convenient for law enforcement not to have to go to a judge, but convenience shouldn't be the basis for rifling through patients' very personal medical records. Eliminating the warrant requirement from the current law only can allow state and federal law enforcement officials to engage in fishing expeditions. There's no other reason not to use the warrant requirement, because they would not be able to engage in fishing expeditions if they had to go get a warrant. The purported safeguards that are in this bill that Pat Quinlan mentioned are really just window dressing. The bottom line is police just need to have a case number, and then they can look at medical records pretty much at will. You've also heard, and it's important to emphasize, if police wanted to go to your home and search your medicine cabinet, they would need a warrant. The fact that these prescriptions are now in electronic form shouldn't change the equation. In fact, it's actually worse, because if police get a warrant to search your medicine cabinet, all they're going to find are the medicines you're using now. They aren't able to find a history of your prescription use, which is what they can get without a warrant under this bill if it passes. People trust the health department to protect the privacy of medical information, not to hand it over to the police without judicial authority. If this bill is signed into law, it will be hard to maintain that trust. If it becomes law, I think we should all be wary of giving the Department of Health any additional powers to obtain medical information for electronic storage, because we simply cannot be assured that the agency is going to stand up for our confidentiality. For all those reasons, we hope that the governor will veto this bill. There are over 20 organizations, many of them very active in the medical, mental health, and substance use treatment communities, all opposed to this bill. I think that sends a very clear message about how dangerous this legislation is. Thank you.